The coronavirus pandemic is causing a mental health crisis among the frontline healthcare workers. One study found that 57% have experienced acute stress and 48% exhibited depressive symptoms. Now, the doctors and the nurses tell us they've been working relentlessly for months, and now they are dealing with new challenges and fears as the number of hospitalizations hits a record high.
Things are pretty tough right now for us. Our med-surg beds are pretty much at capacity, and then we have about 10% of our staff that are out quarantined. So we're facing staff shortages.
It's kind of an exercise in kind of system stress tolerance. How much can we take until the wheels fall off?
Are you seeing your hospital where you're working being overwhelmed with patients?
We're certainly getting a major influx. We're having to manufacture new places to put people.
We're looking at a situation where ICUs are going to be full. Even if we can create physical beds, we just won't have the staff that we need to be able to care for people the way they need to be cared for.
What is it like emotionally at this point?
Healthcare workers are carrying an enormous emotional burden and toll from the last several months. Just the level of fatigue and accumulated trauma our healthcare providers have faced already. We're at a point where people should really be looking to replenish themselves, and instead of replenishing themselves, they're climbing the highest part of the mountain.
I think exhaustion is the biggest. The nurses here are working a minimum of 4 12-hour shifts a week. And then on top of it, having all the schools be out. So you're basically working a 12-hour shift, and then you're going home at night and trying to homeschool your children. And you're doing that day after day after day.
I think a lot of us now are in kind of, for lack of a better word, siege mentality, where emotional considerations just kind of get pushed aside for a while. It is fatigue beyond fatigue.
At the point when we're most worn down, we actually have to do something that is exponentially probably going to be more work than what we've done and dealt with before.
And we can't stay home and work from home. We show up every day and we do the best we can, but you still have to deal with that mental toll it does take on you.
That horrifying fear in the back of your mind that at some point people are just going to die because there's no place for them. That gives me pause.
I do believe that there is this reckoning with how vulnerable we all are to the virus, to the possibility of being overwhelmed by it and death. I think is something that I grapple with as a doctor, but it never became so tangible until now.
What do you want people to know about how healthcare workers are feeling going into another surge?
No matter what, we are here. And in the same way that we'll always be here for you, we also want people to really do all the things we know we can do to stop transmission.
At the end of the day, we're putting one foot in front of the other and showing up every morning, and that is 99% of the battle.
Wow. Our senior medical correspondent, Dr. Tara Narula, is following the effect of the pandemic on the frontline workers and joins us now. Tara, I remember when you did a story like this back in March. It hadn't even been a month. And I remember thinking, God, I never thought of that before, how these people must be feeling who are literally risking their lives to save ours. So what is at stake for them right now? What is the biggest challenge for them?
Well, Gail, you heard the fatigue is certainly a challenge, but it really is this sense of being in a marathon, and it's just a relentless pace that doesn't let up for all of these months. The concern that they're just going to, as Dr. Nielsen said, drown under the weight of all of these patients. How are they going to take care of them? But one of the other biggest challenges is feeling like people still aren't taking this seriously. Walking out of the hospital, seeing people not wearing masks, in lines, packed together, waiting to get into a bar. And that's why many of them have turned to television or social media to tell those personal stories, thinking maybe that will make an impact. This is what we're witnessing inside the hospital. Dr. Dillon in the piece telling us one of the darkest moments for him was telling 2 teenagers that their father died in his ICU, and then 3 days later that their mother died. All of this over the phone without these kids being able to say goodbye to their parents, to see them. So these are the stories that we hope will make an impact on people so they take these mitigation strategies seriously.
They must go nuts when they walk around and see people being so careless and reckless. I heard one doctor say it's like running a marathon, what you just said, and then being asked to do the Ironman right after that. There's just no let up. Do they have any silver linings? Do you see any silver linings for them?
Well, certainly they talked about the hope associated with a vaccine, and also hearing these survivor stories and seeing survivors, that gives them the strength to keep going. They also talked about the camaraderie being a silver lining, that they really bonded being in the trenches together. But as Dr. Nielsen said to us, there is a light at the end of the tunnel, but it's a very long tunnel still.
Gosh, Tara, thank you very much. I think these stories are so important to remind people again, wear your mask.